Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
We always hear about, drinking too much and how it can really mess up your liver. But what if I told you there's like this hidden problem going on? And it's hitting young people, especially young women, way harder than we thought.
Yeah, it's definitely a worry, and there's some really strong research to back it up.
For this deep dive, we're going deep into a study from JAMA Network Open. It's called Alcohol-Associated Pancreatitis and Liver Disease Among Adolescents and Young Adults. It uses like a massive amount of data collected over 18 years from Ontario, Canada. And it really shows us some stuff we didn't expect. We've also got some great extra info from a Medical Express article.
This study really makes us think about how alcohol affects more than just the liver, especially in younger people.
Okay, so let's break this down. What exactly were the researchers looking for?
Well, they wanted to see how alcohol was affecting different organs, not just the liver in people between 13 and 39 years old. And they looked at emergency room visits and hospitalizations, not just deaths.
So they were getting like a real-world picture of how alcohol was impacting young people's health for almost 2 decades. That must be a ton of data.
It is. They looked at over 11,508 cases of organ damage from alcohol. So it gives us a pretty good idea of what's going on.
And what were some of the things that really stood out to you?
Well, the biggest problem wasn't actually with the liver, which is what a lot of people might think. The pancreas was affected in 29% of the cases.
Wow, 29%. That's a lot more than I would have guessed. What kind of damage are we talking about here?
Mostly it was acute pancreatitis, which is like a sudden inflammation of the pancreas. It can be really painful and sometimes even deadly. The liver was involved in 19% of the cases. But what's interesting is that both the pancreas and liver problems were increasing faster in women than in men.
That's really concerning. Why do you think we're seeing such a difference between men and women?
There are a few possible reasons, and it's probably a mix of things. It could be that women's bodies just process alcohol differently, which could make them more likely to have organ damage even if they drink less.
So there could be like a basic difference in how men and women's bodies handle alcohol. That's really interesting, but kind of scary too.
Yeah, and then there's also the whole thing about changing drinking habits. We know that binge drinking is becoming more common, especially among young women, and that puts a huge strain on the organs.
So it's not just how much you drink in total, but also how you drink it. Drinking a lot in a short amount of time seems to be especially bad.
Right, and we also have to consider that maybe we're just getting better at diagnosing these problems in women. Doctors might be more aware of it now, so they're finding more cases.
That makes sense. So it could be biology, behavior, and even changes in how we diagnose these things all mixed together. Does the study tell us anything about which of these factors might be the most important?
Well, one problem with the study is that it didn't have information on how much each person actually drank or how serious each case was. So it's hard to say for sure what's causing these trends. But even with those limitations, the findings are still really important and raise some big questions.
Definitely. These trends are pretty worrying, especially for young women. Knowing that there could be damage beyond just the liver makes me think we need to change how we talk about alcohol and its risks.
I think you're right. We need to be more thorough and not just focus on the liver. The authors of the study specifically say that we need more research on these trends, and that doctors who specialize in the digestive system need better training on addiction. Because it's not enough to just treat the damage, we have to address the root of the problem, alcohol use itself.
So it's about a more complete approach that recognizes the connection between physical health and addiction.
That's a really good point. We'll be right back after a quick message.
And it's important to realize that this is probably happening in other places too, not just Canada. We're seeing the same kinds of things in other countries, which means it could be a global trend.
So it's not just a local thing, it's like a wake-up call for all of us, wherever we live. Makes you think if there are like bigger things going on in society that are causing this. Definitely. Think about social media and how much influence it has. Alcohol is always shown as something glamorous and fun. You never see the bad side of it.
That's true. You see influencers promoting brands and making it look all cool and sophisticated. You never see the pancreatitis or any of the other serious stuff.
It's all about creating this image that hides the real harm that alcohol can cause. It makes it really hard for young people, especially women, to make good choices about drinking.
It makes me think about public health campaigns and how we can fight back against those messages. How can we reach young people in a way that really connects with them?
That's a really important question. The old ways might not work anymore with everything being online now. We need to be more creative, more real, and meet young people where they are.
I wonder if we could use social media itself to spread awareness, but do it in a way that's interesting and relatable, not preachy or judgy.
I think that's a good idea. We need to move away from just scaring people and instead give young people knowledge, critical thinking skills, and the ability to make healthy choices for themselves.
It's about starting a conversation, not ending it. Do you think this study gives us any clues about how to make those public health messages better?
One of the big takeaways is that we have to expand our understanding of the risks. For a long time, it's been mostly about the liver. But if we start talking about damage to other organs like the pancreas, it might have a bigger impact, especially for people who don't think they're at risk for liver problems.
It's like revealing a hidden danger. Suddenly the risks feel more real and more urgent. It's not just this abstract idea of liver damage sometime in the future.
Exactly. And if we emphasize how fast these problems are increasing among young women, we might be able to get their attention and make them reconsider their drinking habits.
It's about changing the message from, this is what could happen to you when you're older, to, this is what's happening to people your age right now.
Exactly. And by framing it as part of their overall health and well-being, not just a moral issue, we can make the message more relatable and powerful.
This study also shows how important early intervention is. If these problems are becoming more common in younger people, then we need to find those who are at risk and give them support as soon as possible.
Absolutely. And that's where training doctors about addiction becomes really important. If we give healthcare providers the skills to spot and address potential alcohol use disorders, we can intervene before the damage becomes permanent.
It's about treating the whole person, not just the symptoms. It seems like we need to change how we think about healthcare, going beyond just fixing the physical damage and recognizing the underlying behaviors that contribute to these problems.
You're absolutely right. It's about taking a more holistic approach that combines medical expertise with an understanding of the psychological and social factors behind alcohol use.
It's about giving both healthcare professionals and patients the power to have open and honest conversations about drinking and its risks. What advice would you give to someone listening who's worried about their own drinking habits or those of someone they care about?
The most important thing to remember is that you're not alone. Alcohol use disorders are really common, and there's help out there. If you're worried about your own drinking, talking to a doctor is a great first step. They can figure out your situation, give you advice, and connect you with resources.
It's about taking that first step, even if it feels scary. What about someone who's worried about a friend or family member?
It can be hard to bring up these concerns with someone you love, but it's important to remember that open and honest communication is key. Tell them you're worried without judging them. Share information about the risks, and encourage them to get professional help if they need it.
So be supportive, but don't enable them. Are there any resources you recommend for people who want more information or support?
There are a lot of great organizations dedicated to helping people with alcohol-related problems. The National Institute on Alcohol Abuse and Alcoholism, NIAA, has a ton of information and resources on their website, including tips for talking to loved ones, finding treatment, and supporting recovery. There are also groups like Alcoholics Anonymous and Smart Recovery that offer support groups and programs.
Those sound like really helpful resources. We'll make sure to put links to those organizations in our show notes for anyone who wants to check them out. This has been a really insightful conversation, and I think we've covered a lot. Do you have any last thoughts before we wrap up?
Yeah, it's been really eye-opening, for sure. I think for me, the thing that really surprised me was how fast these cases are going up in young women. Like, that really hit home.
Yeah, it's a serious reminder that we can't just sit back and do nothing. Things are changing when it comes to alcohol and how it harms people, and we need to change how we think about it and what we do about it. And for so long, it's been all about the liver. But this study really shows that we need to look at the bigger picture when it comes to alcohol.
Right. By recognizing that other organs like the pancreas can be damaged too, we can get a much better understanding of the risks involved.
You know, as we've been talking, I keep thinking about how the study said that doctors who specialize in the digestive system need better training in addiction. What are your thoughts on that?
I think it's really important. If we give those doctors a better understanding of addiction, they'll be able to spot the signs earlier and offer the right kind of help and support to people who might be struggling with alcohol use disorder.
It's about going beyond just treating the physical symptoms and really looking at the behavior behind it all.
Exactly. It's about taking a more complete approach that sees how physical health, mental health, and addiction all connect.
Well, this deep dive has definitely given us a lot to think about. Before we go, I want to leave our listeners with one last question. We talked about social media and public health campaigns, but what about personal responsibility? How can we empower people to make good choices about their drinking and create a culture where moderation and awareness are valued?
That's a really important question. I think it comes down to education, open communication, and having environments that support healthy choices. It's about giving people the knowledge they need to make smart decisions, encouraging honest conversations about alcohol and its risks, and creating a culture where moderation is seen as a good thing, and where getting help is seen as a sign of strength, not weakness.
So it's about shifting the focus from blame and stigma to understanding and support.
Absolutely. By working together, we can make things healthier and safer for everyone.
This has been a really insightful conversation. For our listeners who want to learn more, we'll put links to the JAMA Network Open study and the Medical Express article in our show notes.
And remember, knowledge is power. The more we know about the risks of drinking, the better we can protect ourselves and the people we care about.
Thanks for joining us on this deep dive. Until next time, stay curious, stay informed, and take care.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.